Well, I'm Sean Mayes. I'm the Cardiac and Pulmonary Rehab Supervisor of the program here at Cleveland Regional Medical Center.
I'm Casey Southards. I'm the registered nurse for the rehab program.
Essentially, cardiac rehab is a process by which if a patient's had open heart surgery, angioplasty, a stent, a valve replacement, a heart attack, those kind of heart interventions, cardiac rehab is a process to strengthen that patient's heart and lungs with endurance and strength. We do that by walking them on a treadmill, bicycles, arm machines, Stairmasters, those kind of things. And a big piece that Casey helps us with as well is the education from a nursing standpoint. A lot of these patients are fresh out of surgery, about a month out of surgery. So exercise physiologists, we provide the exercise education piece for the patients, and then Casey provides the nursing aspect to these patients. So once they're to us, they're not well. There still starts their rehab process. So a process of about 3 months of supervised exercise with education from Casey, us, registered dietitian, social worker, respiratory therapist. It's an ongoing thing. So this is just the start once they get to us.
When they first come in, they're very anxious, as I imagine anybody would be, coming out of heart surgery, straight to exercise. Usually it's about a month after open heart surgery that they come to us. They've been cleared by their physician. We start them out as slow as we can. They're monitored constantly on the monitoring system that we have, making sure that all their heart rhythms rate stays exactly where we want it, that nothing changes. So we take them from being extremely anxious about doing anything around the house, yard work, here and exercise, to being extremely comfortable 3 months later, going back to more normal activities without being scared they're going to have another heart attack.
The patients come 3 times a week to cardiac rehab, and the hours of the day anywhere from 7 in the morning till 1:30 in the afternoon. The patients come in, we get their weight, their body weight, we get their resting blood pressure, we put a monitor on them, and Casey is watching the monitor, their EKG, the electrical part of their heart, through an EKG while they're exercising on the treadmill. And then we start them out with a little warm-up to get the body warm for exercise, loosen up all the muscles and tendons, all those kind of things. And then we start them out on a treadmill for about 20 minutes. And patients are generally apprehensive about starting out on the treadmill. Most of them never been on a treadmill a day in their life. But we're right there. We got safety harnesses. We're usually standing right beside them with them and telling them exactly what speed to do the treadmill. They're monitored the whole entire time. We usually take a maximum blood pressure while they're on the treadmill. And our goal is for about 20 minutes on the treadmill, if they can tolerate it. And then after that, we give their legs a break and go to an arm machine where they're doing like an airdyne. They're going back and forth with their arms. And if you think about it, it kind of makes sense, because if they've had a sternotomy where they've had open heart surgery or valve or whatever, we're trying to strengthen those upper body muscles. And then we'll do about 10 minutes on that. And then after that, we do a recumbent bicycle where they sit down and pedal with their legs for 10 minutes. So once that's done, we come back to our cool down area and kind of cool down to some music, bring the heart rate, blood pressure, temperature all back down to normal, get another blood pressure, and then out the door they go. And you do that 3 times a week for about 12 weeks. So we get to know the patients pretty good after those 3 months.
I would say after they complete rehab, they're in the best shape, most of them, that they've been in years or their whole life.
Do most of them stay committed to exercise after that?
I would say the majority of them do. They keep exercising either with us. We have a program where they can come back and continue without having to wear the heart monitor all the time. If they're not with us, they have something else in the community that they've found. But I would say 90%.
Oh yeah.
Keep coming here to exercise while we have the doors open.
Casey, you said you're into a lot of education. Exactly, apart from just how to do the exercises and such, what other things do they educate them about?
It's usually specific to what they've had done, what surgery they've had. Going through cardiac anatomy, how the heart functions as a whole. Most people don't understand what all the heart does. They go through medication education, and that's specific to the patient too, what they're taking.
Well, we do a lot of diet education. Casey does a great job with the medication education. There's so many things that are unsaid that most people take for granted. And, when you have a heart event like that and you come out of the hospital and you're on 6 to 5 to 10 different medications and you've never been on them your whole entire life, you need somebody on your cardiac care team that can explain to you what each medication does and why you're taking it, how long, what side effects are going to be, and you need somebody telling you what those medicines do. And if there's changes or if you forget to take it, then somebody needs to tell you the importance of that. So that's why it's imperative that every cardiac rehab program across the nation's got a nurse and a team of professionals that have their own little expertise that work together as a team to kind of take care of that person as a whole. And over the years, our clientele as a whole, the average age keeps going down and down and down, which, obviously says that people are having heart attacks and heart surgery younger and younger. But the good thing is that we're busy here at the hospital in order to provide this service. I think you'd agree with that, right, Casey.
We saw
840 or 50 last month visits. Now, not people. We've got about 100 people total in the program, a little over 100. Mm-hmm. But if they're all coming 3 times a week, 2 times a week, that's 800 and some visits for the month. So we're busy enough. Yeah. But the only thing that I can tell you mainly is there are kind of 3 areas that you need to be watching. And one area is your diet. There's a vast majority of research out there that says your diet proportionately has an effect on you developing coronary artery disease. I mean, I think that's a given. Everybody'd agree on that. So one aspect's that. Second aspect would be exercise. We've never known anybody to die from too much exercise, though it has happened, but very rarely. Most people who exercise live a long, long time. And we know that exercise makes your coronary arteries and all your vasculature real soft and supple. And then the third thing is to stay regular with your doctor. So, I mean, we could probably talk 3 hours on that.
And then, too, if it's hereditary in the family, definitely talk with your physician, have them checking your blood work, and then that way you'll know kind of what you need to work on food-wise, what you need to stay away from, definitely what exercise you should be doing that they agree with. To try to prevent anything happening.
The good thing about cardiac rehab is that it's different than a lot of other programs, even more different than physical therapy, because these patients come for such a long time. The minimum patients comes 3 months, 3 times a week. Most of us who work don't even get to see our families that much, so we become real familiar and real friendly and almost like a big family here, and I think that's what is not ever put in a brochure and never told on these videos, is that it's like a big family here. They get to know personal stuff about us, and of course we're asking every personal thing about them. I couldn't name one person that I've become friends with, because I've become friends and close to all of them. Everybody. And they end up coming to your wedding. They end up wanting to know when you go on vacation. They end up wanting to know what you did last night, and vice versa. So I mean, out of 100 patients, I couldn't, they're all our friends and our family, and we know a little something about each and every one of them.
Right. I think that's the big thing for the patients too. It's their social group. They all know each other, love each other. They're all best friends. They hang out even outside of cardiac rehab. It's a big family.